West Nile virus or WNV is the leading cause of mosquito-borne disease in the continental United States. It is most commonly spread to people by the bite of an infected mosquito. Cases of WNV occurs during mosquito season, which starts in the summer and continues through fall. There are no vaccines to prevent or medications to treat WNV in people. This virus was first isolated from the blood of a woman in the West Nile district of Uganda in 1937. Mosquitoes of the genus Culex are generally considered the principal vectors of WNV, in particular Culex pipiens. Birds are the reservoir hosts of WNV. Then transmission. Human infection is most often the result of bites from infected mosquitoes. Mosquitoes become infected when they feed on infected birds, which circulate the virus in their blood for a few days. The virus eventually gets into the mosquito's salivary gland. During later blood meals, when mosquito bite, the virus may be injected into humans and animals, where it can multiply and possibly cause illness. So the West Nile virus is the leading cause of mosquito-borne disease in the continental United States. It is most commonly spread to people by the bite of an infected mosquito. Causes of WNV occur during mosquito season. Then human infection is most often the result of bites from infected mosquitoes. Mosquitoes become infected when they feed on infected birds, which circulate the virus in their blood for a few days. The virus eventually gets into the mosquito's salivary gland during later blood meals. When mosquito bite, the virus may be injected into humans and animals, where it can multiply and possibly cause illness. Birds are the reservoir hosts of WNV. The virus may also be transmitted through contact with other infected animals, their blood, or other tissues. A very small proportion of human infections have occurred through organ transplant, blood transfusion, and breast milk. There is one report causing transplacental mother to child WNV transmission, so that can also occur. To date, no human to human transmission of WNV through casual contact has been documented. No transmission of WNV to healthcare workers has been reported when standard infection control precautions have been put in place. Then signs and symptoms. Infection with WNV is either asymptomatic, no symptom, in around 80% of infected people, and can lead to West Nile virus fever or severe West Nile disease. About 20% of people who become infected with WNV will develop West Nile fever. Symptoms include fever, headache, tiredness, and body aches, nausea, vomiting occasionally with skin rash and on the trunk of the body, and swollen lymph glands. Symptoms of severe diseases include headache, high fever, neck stiffness, disorientation, coma, tremors, convulsions, muscle weakness, and paralysis. Infection with WNV is either asymptomatic, so West Nile virus fever, or severe West Nile disease. About 20% of people who become infected with WNV will develop West Nile fever. Symptoms include fever, headache, tiredness, and body aches, nausea, vomiting occasionally with a skin rash on the trunk of the body, and swollen lymph glands. The symptoms of severe diseases include headache, then high fever, neck stiffness, disorientation, coma, tremors, convulsions, muscle weakness, and paralysis. West Nile virus cycle. Mosquito bites bird with WNV. Mosquitoes become infected and spread West Nile virus to people and other animals by biting them. So it is estimated that approximately 1 in 150 people infected with the West Nile virus will develop a more severe form of disease. Serial illness can occur in people of any age. However, people over the age of 50 and some immunocompromised persons are at the highest risk of getting severely ill when infected with WNV. The incubation period is usually 3 to 4 days. Treatment is supportive for patients with neuroinvasive vaginal virus, often involving hospitalization, intravenous fluids, then respiratory support, and prevention of secondary infections. No vaccine is available for humans. River blindness, onchocerciasis, commonly known as river blindness, is caused by the parasitic worm Onchocerca volvulus. It is transmitted to humans through the exposure to repeated bites of infected black flies of the genus Simulium. Symptoms include severe itching. It is transmitted to humans through exposure to repeated bites of infected black flies in the genus Simulia. Symptoms include severe itching, disfiguring skin conditions, and visual impairment, including permanent blindness. More than 99% of infected people live in 31 African countries. This river blindness is a parasitic disease caused by the filarial worm Onchocerca volvulus, transmitted by repeated bites of infected black flies. So the black flies breed along fast flowing rivers and streams close to remote villages located near fertile land where people rely on agriculture. So in the human body, the adult worms produce embryonic larvae, microfilaria, that migrate to the eyes, skin, and other organs. When the female black fly bites another infected person during the blood meal, it also ingests microfilaria and they develop either further the black fly and are then transmitted to the next human host during subsequent bites. Then transmission during the blood meal, an infected black fly introduces third stage filaria larvae into the skin of the host, no, human host, and where they penetrate into the bite wound. In subcutaneous tissue, the larvae develop into adult filariae, which commonly resides in nodules in subcutaneous connective tissue. Adults can live in the nodules for approximately 15 years. Some nodules may contain numerous male and female worms. In the subcutaneous nodules, the female worms are capable of producing microfilaria for approximately 9 years. The microfilaria have a lifespan that may reach 2 years. They are occasionally found in peripheral blood, urine, and sputum, but are typically found in the skin and in the lymphatic or connective tissue. A black fly ingests the microfilaria during a blood meal. After ingestion, the microfilaria migrate from the black fly's hind gut through the hemocoel of the thoracic muscles. There are microfilaria develop into first stage larvae and subsequently into third stage infective larvae. The third stage infective larvae migrate to the black fly's proboscis and can infect another human when the fly takes a blood meal. So this shows an overall picture of this. Black fly takes a blood meal, then human stages, subcutaneous tissue. Adults in subcutaneous nodule. Adults produce unsheathed microfilaria that typically are found in skin and in lymphatics of connective tissue, but also occasionally in peripheral blood, urine, and sputum. Then black fly takes a blood meal. Microfilaria penetrate black fly's midgut and migrate to thoracic muscles. L1 larvae, L3 larvae migrate to head and black fly's proboscis. Black fly stages are also shown in this picture. Then signs and symptoms. It is possible for the larvae to move through the body without triggering a response from the host's immune system. So some people who are infected with the parasite experience no symptoms. So almost all the clinical manifestations of onchocerciasis are due to localized host inflammatory responses to dead or dying microfilaria larvae. The signs and symptoms of onchocerciasis are typically divided into two categories: skin and eye symptoms. Skin symptoms will develop years before any vision problems. These symptoms include intense itching, swelling, inflammation, depigmentation, hyperventilation, rash, nodules under the skin, skin atrophy. Eye symptoms include vision impairment, low vision or permanent blindness, clouding of the cornea, light sensitivity, lesions on skins, then glaucoma, eye pain, eye redness. Treatment. The treatment of this river blindness is ivermectin, trade name Mectizan. Ivermectin is administered 4 times a year and will be continuously administered for 10 to 14 years due to the lifespan of the adult bone. So probably some no symptoms conditions are also there, like asymptomatic conditions. Localized host inflammatory responses are there. Skin and eye symptoms: skin intensity, swelling, inflammation, depigmentation, hyperpigmentation, rash, nodules under the skin, skin atrophy. Then eye symptoms: vision impairment, low vision or permanent blindness, clouding of the cornea, light sensitivity, lesions on skin, glaucoma, eye pain, eye redness, etc. The treatment for onchocerciasis is ivermectin. Intense skin itching is eventually relieved and the progression towards blindness is halted. The drug works by reducing the release of larvae from the adult worm, but the drug does not kill it. However, the drug does not prevent transmission of this, so it, however, reduces morbidity and has shown promising results to eliminate in some endemic areas of Africa. An African sleeping sickness. Human African trypanosomiasis, also known as sleeping sickness, is a vector-borne parasitic disease. It caused by the protozoans of the genus Trypanosoma, transmitted to humans by tough tsetse flies, Glossina, which have acquired the parasites from infected humans or animals. Human African trypanosomiasis is caused by protozoan parasites transmitted by infected tsetse flies. It is endemic in the sub-Saharan Africa. Without treatment, hat is generally fatal. Most exposed people live in rural areas and depend on agriculture, fishing, animal husbandry, or hunting. Diagnosis and treatment are complex and require specific skills. Wait a minute, this page I was not paying attention, so I'm going to read once again. It is caused by protozoans of the genus Trypanosoma. Human African trypanosomiasis is caused by protozoan parasites transmitted by infected tsetse flies. It is endemic in sub-Saharan Africa. Without treatment, it is generally fatal. Most exposed people live in rural areas and depend on agriculture, fishing, animal husbandry, and no, I'm sorry, or hunting. Then diagnosis and treatment are complex and require specific skills. Hat takes two forms depending on the parasite subspecies. Trypanosoma brucei gambians, found in 24 countries of West and Central Africa, currently accounts for 92% of reported cases and causes a chronic illness. A person can be infected for months or even years without major signs or symptoms. When evident symptoms emerge, often the disease is advanced with the central nervous system already affected, also called Gambian sleeping sickness. So, Trypanosoma brucei rhodescens, found in 13 countries of Eastern and South Africa, accounts for 8% of the reported cases and causes an acute disease. So, first signs and symptoms emerge a few weeks or months after infection. The disease develops rapidly with multi-organ invasion, including the brain, also called rhodesian sleeping sickness. Transmission during blood meal on the mammalian host. An infected tsetse fly injects metacyclic trypostygotes into skin tissue. The parasite enter the lymphatic system and pass through the bloodstream. Inside the host, they transform to bloodstream trypomastigotes and are carried to other sites throughout the body, reach other body fluids, and continue replication by binary fission. The entire life cycle of African trypanosomes is represented by extracellular stages. The tsetse fly become infected with bloodstream when taking a blood meal on an infected mammalian host. In the fly's midgut, the parasite transform into procyclic trypomastigotes. This, after taking a blood meal, multiply by binary fission. Procyclic trypomastigotes leave the midgut and transform into epimastigotes. The first stage signs. The procyclic trypomastigotes leave the midgut and transform to epimastigotes. The epimastigotes reach the fly's salivary glands and continue multiplication by binary fission and transforms into metacyclic trypomastigotes. The cycle in the fly takes approximately 3 weeks. Signs and symptoms. First stage symptoms for both types of sleeping sickness include headache, malaise, weakness, fatigue, and arthralgia. First stage signs can include hepatosplenomegaly, weight loss, and intermittent fevers lasting 1 day to 1 week. The intervals between fevers can last days or months. Then Gambian's infection progresses to the second stage after an average of 300 to 500 days, whereas TB rhodesian's infection progresses to the second stage after an estimated 25 to 60 days. For both types of diseases, the stage is determined by examining cerebrospinal fluid and observing trypomastigotes. African sleeping sickness. First, tsetse fly takes a blood meal. An infected metacyclic trypomastigote transform into bloodstream trypomastigotes, which are carried to other sites. Trypomastigotes multiply by binary fission in various blood fluids, blood, lymph, and spinal fluid. Then trypomastigotes in blood. Then tsetse fly takes a blood meal. Bloodstream trypomastigotes transform into procyclic trypomastigotes in tsetse flies midgut. Then procyclic trypomastigotes multiply by binary fission. Procyclic trypomastigotes leave the midgut and transform into epimastigotes. Then epimastigotes multiply in salivary gland. They transform into metacyclic hypomastigotes. In second stage disease, invasion of the central nervous system causes a variety of neuropsychiatric manifestations to appear. The sleep-wake cycle becomes reversed and hence a common name African sleeping sickness. The patient who experiences mental, motor, sensory and neurologic signs and symptoms. The treatment of first stage disease is fexinidazole by mouth or pentamidine by injection for this. Then suramin by injection is used for TB rhodesians. Otherwise, a regimen involving a combination of nifurtimox and NECT alone appear to be more effective and result in fewer side effects. Insect-borne human diseases: West Nile virus, river blindness, African sleeping sickness, ambient sleeping sickness, rhodesian sleeping sickness. Thank you for listening.